Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg and I'm a research study coordinator with the Havey Institute. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, he'll be addressing a viewer-submitted question and the latest headlines through today, April 10th. We welcome any questions or comments down below. In the description, you can also find all of our social media, including Dr. Murphy's new Substack, where you can get the answers and sources to all of these questions and topics directly to your inbox. Starting with that follow-up question from last week, we had a viewer ask about leaky vaccines, but they offered a clarifying statement. They said, what I should have said is non-sterilizing vaccine that neither prevents or contracts or prevents contraction or transmission, excuse me. Can you explain what that is
Yeah.
and answer the full question, please?
Well, the non-sterilizing vaccines means the virus is not eliminated. Like measles vaccines, you don't get measles. All right. With the COVID vaccines and the flu vaccines and the RSV vaccines, these RNA respiratory viral infections, you don't get rid of the virus altogether. You can suppress it. You can make it less active. And weaker, and people can have improved survival. They can end up in the hospital less. They can end up in the emergency room less. They can have shorter amounts of infection. They can be infectious for a shorter period of time. So good things, but they are not sterilized. They still have virus replicating. These things are incredibly dynamic. I mean, just the number of viral particles is really astronomical. So, this person is asking this question because they're thinking that, well, the virus is affecting the pool of viruses. The vaccine, excuse me, is affecting this pool of viruses, and that could be a bad thing. Well, the thing is, yes, but it's not really a bad thing because it's the antigen that is produced from the vaccine that the vaccine is stimulating is part of a virus that exists out there. Generally, it's from approximately about a year ago. And every year or so, the vaccines get updated. This is the same with the flu, and we'll see what happens with RSV. That we don't haven't worked that out yet. So you're just going to get parts of last year's virus, and so the consequence I think is insignificant, because as long as you have a replicating virus, it is going to mutate. Um, because the virus just makes mistakes, and some of the mutations are bad and the virus doesn't survive, and some are good and the virus lives better. So it's really trying to get as many people under control from a public health standpoint, and to get to a level where people can tolerate the vaccine better. And so it's not really a bad thing that's happening. It's not a dangerous thing, and it's going to happen one way or the other.
Yeah, no matter if it's a human host or any other animal host, if the virus is transmitted and incubates, it can mutate. And the important thing is the vaccines can keep you from getting severely sick and keep you
Mhm.
alive if you are in a very select group. So
You
just
bring up a
important
good
to
point
keep
because
yourself safe.
you always have to look at risk benefit. A theoretical risk of having, I don't know, some bad mutation. I mean, I suppose, something could happen, but the benefit of keeping people out of the hospital, keeping them alive and keeping them healthier, and all these long-term complications we keep hearing and seeing for all these viruses, is, that's it's always a trade-off.
Mhm. Thank you. That was a very interesting question. And of course, if you have any more, feel free to ask. We'll look into it. But getting into our top published stories for today, we have a report from the CDC on how many doctors, nurses, and healthcare workers are getting those annual COVID and flu vaccines. Can you bring us the numbers?
Yeah, so this is a study in 2,650 healthcare workers, so a fairly good sized study. Like you said, a variety of different healthcare workers. And it turns out for flu and for COVID, the doctors and the pharmacists tend to get vaccinated more. For the physicians and pharmacists, it's in the low 90% vaccine rate. And for flu, in many hospitals, like my hospital, after December 1st, I can't come in the hospital if I haven't had my flu shot. So that's the way it goes. Now, COVID is a different story. It's not mandated. There's no mandates anymore. So and then a lot of people think, well, I've had the COVID so many times and I've had so many different shots. I'm not going to take it this year. And so the rate drops considerably. It's 46% in doctors and 40% in the pharmacists. And then the outlier are the nurses. So for the flu vaccine, it's approximately 80%. And for COVID, it's 26.8%. So these kind of numbers are very typical in the healthcare worker field. The nurses are less inclined to take the vaccines, and the doctors and the pharmacists are more inclined to take it. So this just proves what we already suspected. And it's just a nice report of, what the status is.
A very nice report. And while we're on the topic of the CDC's Morbidity and Mortality Weekly Report, there have been inklings or more than whispers at this point that there was an edition or an issue of this report that was actually delayed. And that is
Yeah.
because it contained some interesting information on the COVID vaccine's efficacy. So, can you share that efficacy with us?
Yeah. So all the studies that looked at COVID vaccines, virtually all, showed that at the beginning, when there was no immunity in the population, was a huge difference in mortality. As the population got infected and survived or got vaccinated, we had the herd immunity get better. There were fewer and fewer deaths. There's still tens of thousands of deaths a year from COVID. So there's more than with flu. So anyway, so the CDC is putting this big report together, and sure enough, the people that had the vaccine, the COVID vaccine, had approximately 50% less hospitalizations and less visits to urgent care facilities. That's a that's a big difference. I don't know about the mortality rate in this particular study. There may not have been a difference, but there was certainly a lot less sick people. So anyhow, they just were going to report it because this is what they do for a living, I mean, people want to know if these things are still effective. And Dr. Bhattacharya, the acting director of the CDC, he also is the director of the NIH. He pulled the paper. He said, interested. I don't think the methodology is good. Well, the CDC is just full of epidemiologists and biostatisticians, and the methodology is the methodology they use for all these studies. And they've been proven time and again that the methodology is okay. So it's just a very suspicious uh, act. And it's going to do is cause more confusion, and instill doubt in people that the vaccines don't work. And so fewer people will take it, and more people will get sick. So it's actually making
Mhm.
people less healthy. So that is what's happening here. We'll see what happens. I'm sure this study is going to be dissected, by the molecule, and we'll get all the data from it. But it's no surprise. This is what all the other studies have shown.
Mhm. This particular study itself has not been published since that
No.
date, so we're unable to fully verify all of the information that was in the study itself. So hopefully we will get to
Right.
see that in the future. But
Hmm.
we do have a different study, this time from clinical ophthalmology, that interestingly showed that eye symptoms may signal higher severity to long COVID. Something I've never heard of. Dr. Murphy, can you break it down?
Yeah, I mean, when we think of long COVID, we always talk about, the nobody even knows how common it is. Is it 7% or more or less, whatever. But anyway, it's real. All right. And we don't normally think of ocular problems with long COVID. We think mostly neurocognitive, uh, brain fog and that kind of stuff, some cardiac things and fatigue and stuff like that. We don't norm People aren't normally thinking about eye problems. However, they showed in this study that yeah, there's a lot of people with eye problems. They get non-specific eye problems, blurry vision, dry eyes, floaters, little black spots people see floating around, and flashes, like see the white spots and stuff. And that if they have those ocular symptoms, they tend to have more other systemic symptoms. So it's just another thing to be aware of. If you've had COVID and all of a sudden you have some eye problems and stuff, it could actually be related to the former COVID. I thought it was just an interesting study that and highlights just some of the things we learn about long COVID, which is still somewhat mysterious.
Yes, different elements coming out from long COVID every month, it seems, with all this excellent
Mhm.
research. So, really glad that this is all getting published and we can continue learning about long COVID.
Mhm.
Switching gears, measles. No update yet. The national numbers will be posted later today, but we can check back in with South Carolina and some of the cases throughout the week. Can you bring us those updates?
So I think this is the third week for South Carolina being with no measles. Congratulations, South Carolina. They have fixed their problem. That's great. And how they do that, big vaccination programs in high risk populations, quarantining people, making the correct diagnosis, etc. So it's left South Carolina, it looks like. I think they have to be 1 month before they sort of go off the high risk list. That'll be next week if they don't have any cases. But the measles epidemic has moved over to Utah. So Utah has is now the epicenter for measles. So this is what's going to be happening. It's just going to bounce around the country. And then it may poop out for a while until there's more unvaccinated people around to get infected. Because remember, if you have measles, you're going to be protected forever. So you don't have to take the vaccine. So that just an update on what's going on with a preventable disease that can kill you.
And on that note, internationally, the country of Bangladesh is experiencing a rapidly growing measles outbreak. And this week, they reported that over 100 children have now died from that measles outbreak. That is how serious this can be, and that's how important the vaccination is.
It's two things. It's a numbers game and it's a infrastructure game. Can you take care of a sick kid with encephalitis, basically, is what it is. So if you have half the population unvaccinated, I don't know what it is in Bangladesh, but there's a lot of people that are not vaccinated. But it's a lot. And you're going to have 100 deaths or whatever. It's just really tragic. And then can the hospital system there, the medical system, can it support kids with very severe measles disease? So it's two things that can increase the numbers, but remember, it's a preventable disease with a very inexpensive, highly effective vaccine.
Mhm. Very tragic over there. And our last story today, not measles, but it is about a different vaccine. That is a new phase 2 trial for Sanofi's yellow fever vaccine. Can you tell us a little bit about it and how these phase 2 trials went?
Yeah, it's a different way of manufacturing without using eggs, and it's a live attenuated vaccine, but it's a simpler method technology. Sanofi's a big vaccine company, France. Anyway, it looks like it works. So we have a big step in improvement. in the yellow fever period for people that are traveling to places with yellow fever. Yellow fever can be very deadly, and some countries mandate that you're vaccinated before you can come in the country. You get these little yellow international cards. It has to be stamped with a stamp within 10 years. And, you don't want to get yellow fever. It's really, really quite bad. So this is just a big improvement. It was published in the New England Journal, which is the top journal in the United States. So it's just showing how important this is for public health globally.
Absolutely. We will follow along with that story and all others mentioned today. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise this morning, answering our questions and breaking down all the important information.
Great. Thank you, Katie.
And thank you all for joining us for Ask Dr. Murphy this week in public health. We hope to see you back next week. And as always, any questions or comments are welcome down below or at any of our social media. Have a lovely weekend.